Hi, and welcome back to the Hospice Volunteer Training Series. This segment will be focusing on safety and infection control. If you'd like to follow along, please turn in your manual to the section marked Safety. Because hospice provides medical care for the terminally ill, it's important that volunteers have an understanding of how to prevent the spread of infection. Your safety and the prevention of the spread of infectious disease is a high priority. If you have never worked or volunteered in a medical setting, you may be unfamiliar with safety precautions and procedures used to prevent the spread of disease. If you have some familiarity with the subject, then this will simply be a review for you. Human blood and certain body fluids are carriers of infectious disease. Varied types of microscopic germs such as viruses, bacteria, parasites, and fungi cause these diseases. Body fluids that can carry infection include semen, vaginal secretions, and other fluids such as spinal and amniotic fluid. Healthcare professionals must protect themselves whenever the potential for exposure to blood as well as these body fluids is possible. The protection devices and procedures used by medical professionals are known as universal precautions. They were established by the United States Centers for Disease Control. All patients are assumed to be infectious, thus requiring medical professionals to use the necessary universal precautions, barriers that protect the healthcare worker from body fluid. One form of barrier is referred to as personal protective equipment, or PPE. It includes things like gloves, masks, eyewear, gowns, or lab coats. Their purpose is to protect the worker's own clothing, skin, or mucous membranes. Another barrier is referred to as engineering controls and includes things like disposal containers for sharps and hazardous waste. Ventilation for hazardous fumes would be another barrier. Health facilities must provide the means for proper disposal of dangerous items as well as making sure the environment stays clean. A third form of universal precaution barriers would be work practice controls. Required hand washing and policies regarding handling and disposal of sharps and contaminated materials are examples of work practice controls. Each health facility has a set of policies and procedures that provide direction for their staff members regarding these and many other topics. Everyone stays safe when staff members follow correct procedures. Universal precautions are designed to protect the patient and the medical worker. They provide protection from blood-borne infections such as HIV and hepatitis B. These infections are spread through blood, semen, vaginal secretions, and the other body fluids mentioned earlier in this segment. They are not spread through feces, nasal secretions, sweat, tears, urine, vomit, or saliva unless it has been contaminated with blood, such as when dental work is performed. In your role as a volunteer, it is highly unlikely that you will need to use barriers to protect yourself from blood-borne infection. You will not be providing any type of medical care and therefore should not have the opportunity for exposure to a patient's blood or potentially infectious body fluids. However, many other types of bacteria and germs are spread in everyday life. We all must use good basic hygiene in order to protect ourselves, our patients, and our families from these commonly spread bacteria and viruses. Flus, colds, and respiratory infections are spread easily from person to person. When we sneeze or cough, respiratory droplets spread out as they travel through the air. They can land on another person. They can land on surrounding surfaces, which are then touched by other people. Some of these bacteria can live up to 2 hours. As people touch the surface and then touch their eyes, nose, or mouth, the bacteria enter their body. It's no wonder that these germs spread so quickly in places where people are sneezing, working, or living in close proximity. We can all protect ourselves by covering our mouth and nose with a tissue when coughing and sneezing. If we don't have a tissue, we should use our hands to stop the spray. Then we should wash our hands immediately afterwards. Probably one of the most effective means of protecting ourselves is by washing our hands thoroughly and often. Using soap and water while briskly rubbing your hands for 15 to 20 seconds is best. Unfortunately, many people do a quick plunge under the water and think their hands are clean. It's important to wash for the suggested amount of time. The Center for Disease Control suggests singing a tune such as the Happy Birthday song twice to help remember how long to wash. However you do it, try to wash for the full 15 to 20 seconds. Hand sanitizers or disposable hand wipes are also effective when soap and water are not available. These products are alcohol-based, which kills the germs without using water. We cannot emphasize enough that one of the most important things anyone can do to prevent the spread of germs is to wash their hands thoroughly and often. Remember what our mothers used to say, wash your hands before coming to the table. At the very least, add to that, wash after using the bathroom or changing a diaper, after handling garbage, after touching raw meat, after blowing your nose or coughing, after touching animals, after working in the yard, after visiting a sick person, after a shopping expedition, and after being in social settings. Washing our hands seems simple enough, but surprisingly, there's more to it than you might think. We've already mentioned the need to spend enough time washing. In addition to the time factor, there are other guidelines and techniques that should be used. Wash your hands by rubbing them together. This causes friction, which removes contaminants and dead skin. The soap you apply breaks down the oils on the skin, helping to release contaminants. The slipperiness of the soap helps the germs slide away. Warm running water helps wash all the germs, dead skin, and contaminants away. Any soap works to release the germs, but antibacterial soaps kill the germs in addition to helping release them. However, there is some concern over the use of antibacterial soaps on a regular basis. Some believe that the overuse of antibacterial soaps will build up a resistance to common germs. If you don't wash your hands frequently, you run the risk of exposing yourself to bacteria when you touch your hands to your eyes, nose, or mouth. You also run the risk of exposing others to these same bacteria and continuing to spread them. You touch something, someone else comes along and touches it, picking up the contaminants you left behind. This cyclic spread of germs continues until you wash the germs away, breaking the cycle. Thorough hand washing means wet your hands under running water. Apply soap. Rub your hands together to produce lather and friction. Wash between fingers and make sure soap lather gets under fingernails. Rub your hands for 15 to 20 seconds. Rinse thoroughly under running water. Try not to use your clean hands to turn off the faucet. Use a paper towel if available, or your elbow. Pat your hands dry with a fresh paper towel, or use an air dryer. Let's backtrack now and talk about what you should do in the unlikely case that you would be exposed to blood or body fluid while visiting your hospice patient. The first thing to do would be to wash the exposed area immediately. Next, report the incident to hospice. Thoroughly describe what happened. Were you punctured by a needle or other sharp object used by the patient? Did blood or another body fluid splash on your skin, mouth, eyes, or nose? Is your skin broken? Did you have direct contact with a large amount of blood or body fluid? How long was the contact? Did you wash the exposed area immediately? These details will determine the types of testing and treatment that will be used to provide follow-up care. Remember, it is highly unlikely that you will ever be exposed to a patient's blood or body fluids because you will not be providing medical care. Your hospice volunteer work may take place in medical settings or in private homes. Either way, you need to understand the necessity of keeping yourself and your patient safe. Besides hand washing and the use of universal precautions, there are other ways to protect ourselves as well as others. If you are ill, do not visit your hospice patient. Call and reschedule. Your patient and family will appreciate the fact that you will not be bringing your germs into their environment. If visiting in a medical setting, wear closed-toe shoes. This will protect your toes from medical equipment such as moving wheelchairs. If your patient uses a wheelchair in his or her home, you might consider wearing closed-toe shoes there as well. Wash your hands before handling food. When handling food, do not handle dirty dishes and then handle clean dishes or food without washing your hands in between. It takes all of us working together to keep ourselves safe from unnecessary health risks. We hope this segment has provided some insight as to how to protect yourself and your patient from infectious germs. Remember, the most important thing you can do to protect yourself is to wash your hands thoroughly and often. Wash before you visit your patient and wash after your visit. Stop the cycle of contamination by simply washing your hands. Thanks for watching this important segment on safety and infection control. You've now completed this section, so please take some time to look over the materials, then locate and complete the competency quiz. We'll see you back here when you're ready to begin the next segment.